Assalamualaikum doctors. In this video I am discussing a recall communication that is a known case of diabetes mellitus came with hypoglycemic coma. Okay. So suppose Ali had attack of hypoglycemia. I felt so guilty. I felt I'm a bad mom. So as usual we are IRCAP, we are starting when we ask the mother what about the concern. Then Ali had attack of hypoglycemia and the mother is feeling guilty. I felt I'm a bad mom. No madam, actually you are one of the best ma'am. And you were so brave to bring him in the right time. You saved his life. I'm sure Ali is proud of you and you should be proud of yourself. Oh, thank you, doctor. Tell me, how can I help you? So I want to know why this problem to happen. So she asked about the causes. How could I treat? Best way to treat is to prevent the causes. How could I prevent it? I must know the cause to prevent it. Okay, then we tell one by one. This may occur. Why hypoglycemia occur? This may occur if he take too much insulin or too deep insulin, and if he make too much exercise or missing a meal. If older children add alcohol in cases. So causes are because of the maybe too much insulin taking or too deep insulin, too much exercise and missing a meal. If older children add the alcohol. So what can I do if he have hypoglycemic coma? First of all, we have to recognize hypoglycemia early and to be able to treat it. Am I right? Yes, doctor. So if he became suddenly hungry, little bit irritable, shaking his hands, cold sweats, at this time you should measure the blood sugar. If a reading is below less than 4 millimole, this means that he had hypoglycemia. Are you with me? So suddenly become hungry, a little bit irritable, shaking his hand and cold sweat. Suddenly little bit hungry, irritable, shaking hand, cold sweat. Then this time the measure the blood sugar. If it is less than 4 millimole, that means it is a hypoglycemia. Okay, doctor, what can I do after? According to his conditions, if he is awake, he can take something we call rapid acting curve, which rise his blood sugar quickly, like for example sweets, candies, or something called dextrose tab. This followed immediately by another type of food that rises his blood sugar slowly and will keep at the optimum level like biscuit or banana. Am I making myself clear? So if his this hypoglycemia feature we find sugar level is less than 4 millimole, what we do? We give some rapid active insulin like chocolate, candies, these are we are giving. Then again immediately we measure the blood sugar. To keep the optimum level, we give also biscuit, banana. Okay, doctor. But if he is not active, like he became drowsy, you will add a gel called hypostop gel. It is a gel applied to the inner side of the cheek. So after sweet candy, we are giving hypostop gel. Hypostop gel inside the cheek. But doctor, I do not have this gel. So we can put honey to the inner side of his cheek. Am I clear till now? Okay, doctor. But what will I do if he is in a coma? If he is in a coma, after calling ambulance, you will give him glucagon injections, and I will arrange a meeting with the diabetes nurse to show you how to use it. So hypostop gel, but the child is in coma, then we give the glucagon injection and we will arrange a diabetic nurse who will teach you how can use it. So what is glucagon injection? I am telling shortly. It is an orange box in which you will find a powdered medicine in a vial and a syringe pre-filled with water. Okay, you will empty the syringe in this vial of medicine and shake it very, very slowly, and after that you will draw the medicine and inject into the outer side of the middle third of the thigh. After that you will put him on his side, cause this medicine causing some nausea and may throw up. So glucagon injection box, inside there is a vial containing powder and also a syringe. This syringe water will enter into the vial and shaking and mixed it, and after that again with the syringe we will give it in the outer thigh, and after that he will be aside because it causes nausea. So next question, so doctor, we need to change his dose of insulin. The best one to answer of this question is the gland doctor. We will arrange a meeting with him as soon as possible. The summary, trusted website, written leaflet, support group lies with the diabetic nurse. Maintain a diary about glucose record and carb count also we add in this communication. Thank you.